Dr. Gounder, I want to ask you about kids under 12. And we know that there are clinical trials ongoing to try to get the vaccines authorized for this group. This group, compared to teens, actually has an even lower risk of dying from COVID-19. 159 kids under 12 have died from the virus. How do you think, there's been a lot of debate about, given those risks, do we give vaccines to younger kids, knowing that in other countries there are adults and older people who don't yet have access to the vaccines? How do you think about that?
So just briefly, actually going back to the previous question, your listeners, viewers may be interested in reading an op-ed I published with Dr. Jeremy Faust and Katie Dickerson Myers in the New York Times, your competitor, I suppose, on July 4th, which addresses specifically this question of the risks of vaccinating versus the risks of getting COVID among younger people, so including teens and children. And so we lay out the calculations there so you can see, if we allow the virus to spread across the country, if everybody, under 18 eventually gets infected, how many hospitalizations do you get from that? And how many hospitalizations do you get if everybody gets vaccinated? And that's really the choice here, is do you get infected or do you get vaccinated? As Dr. Jha said, we are looking at an infection that is likely to become endemic, which means that all of us will encounter it. The real question is, do we encounter it as a vaccinated person or as an unvaccinated person? So those calculations are pretty clear. Your rate of hospitalizations are much, much lower if we really try to get all those younger people vaccinated. Now, as to your question about even younger, the under 12, again, this is not a risk-free infection. And so the risk of the infection remains higher than the risk of vaccination. So I think that's, point number one. We are seeing long COVID. We have this syndrome, MIS-C, which is when COVID affects multiple organ systems in pediatric patients. We simply do not know what are the really long-term effects of SARS-CoV-2 infection in children under 12. In contrast, what we do know with vaccines, and this goes back over 250 years with our experience with vaccines going back to the very first vaccine, smallpox, we know that if somebody's going to have a side effect from vaccination, that happens within the first 2 months after vaccination. So we know that 2 months is actually quite robust follow-up. That is not the same as with an infection. With an infection, you could have long-term consequences much, much farther out, and we're still learning what they are, and they clearly are significant even in the under 12 population.